Tuesday, March 31, 2020, news broke out about the death of a civil law student of St. Thomas University named Mario Cruz Jr., who was later found to be one of the pledges of the Delonix Regia fraternity.
We were having breakfast when my son just suddenly fainted. He hit his forehead at the edge of our glass table. We tried to wake him up, but he was unconscious. Then he only woke up when we're on our way to the ER. When we had him checked, the doctor said there was nothing wrong with him. He had a slightly low BP. They only stitched up his forehead. Then we were discharged after an hour of observation.
The same day around 7 p.m., I went up to call him for dinner. He was on his bed, so I thought he's just resting. But when I tried to wake him up, he wouldn't respond again. His hands were so cold. So we immediately brought him to the ER. But he was dead on arrival.
According to his parents, the death of Mario was sudden and unexpected, leading to the suspicion that his injuries were sustained during the initiation rites of his fraternity, which was held the night before his death.
At that time, I didn't understand what happened because our son was perfectly healthy. And as parents, we've always tried to protect our son from harm. But now, he's dead. Our precious son is dead.
We are ready to file multiple cases against all of these people who are involved. We will not stop until all of these people pay for what they did to our son.
Mrs. Cruz, you mentioned that your son was perfectly healthy. Can you state your definition of healthy? Because according to his medical records, he was diagnosed to have ventricular septal defect shortly after birth.
Yes, but it was already treated surgically. And aside from that, he was never been diagnosed with any other disease.
No further questions, Your Honor. Thank you.
The prosecution may now call on their second witness.
Your Honor, the defense is claiming that Mr. Mario died as a consequence of previous illness. But our next witness will prove that he died of a much more sinister reason. May I call PNP Detective Mr. Santos? Mr. Santos, will you please state your full name for the record?
Rafael Santos.
How were you involved in this case?
Mr. and Mrs. Cruz approached me after the mortician reported to them the presence of bruises on Mr. Mario's abdomen and thigh. This led them to suspect foul play. So after my investigation, I discovered that Mr. Mario was part of the Delonix Regia fraternity pledges and that they held an initiation rite on the night before he died until early morning. I also discovered that the attending clerk is a senior member of the same fraternity.
So are you implying that there was manipulation of medical records by the attending clerk?
Objection, Your Honor. Speculation.
Sustained.
No further questions, Your Honor. Thank you.
Does the defense want to further cross-examine the witness?
No, Your Honor.
The defense may now call on the next witness.
Calling Mr. Padilla, the medical clerk who was assigned to assess the patient in the ER. Kindly state your full name.
My name is Luke Padilla.
Mr. Padilla, when you examined Mr. Mario in the ER, what was your assessment?
At around 10 a.m., Mr. Mario Cruz, a 20-year-old male college student, came into the ER due to syncope 1 hour prior to admission. And from my observation, he was conscious and he was coherent. There was also a 3 cm long laceration at the right side of the face that was running from the hairline up to the eyebrow area. His vital signs, his neurological exams were both unremarkable, except for a low normal blood pressure.
No further questions, Your Honor. Thank you.
The prosecution may now cross-examine the witness.
So, Mr. Padilla, you said that you checked Mr. Mario's vital signs and performed a neurological examination, but you did not conduct a complete physical exam. Is that correct?
Yes.
Is there a reason behind this?
I did not see a need for a complete physical exam due to the nature of his chief complaint.
Based on the recorded interview transcript with Mr. and Mrs. Cruz, they also observed that their son was limping. Why was this not mentioned in your general survey of the patient?
Mr. Padilla, answer the question, please.
Because it slipped my mind. It was a very busy day at the ER.
Ladies and gentlemen, we have a clerk here who was expected to have enough knowledge on the basic protocols of proper history taking and physical examination. But he managed to miss out on the obvious limping presentation of the patient. Did he really miss out, or was it intentional, given that he is a senior member of the accused fraternity?
There will be a 2-minute recess.
May I offer the autopsy report into evidence?
Go ahead.
Dr. Exconde, will you please state your full name for the record?
I am Dr. Marielle Exconde.
Can you narrate the victim's external findings?
We received the body in a black bag and we did the autopsy at around 8:30 p.m. on the 31st of March 2020. The patient is male, having characteristics of a well and normally developed Filipino, measuring 5 feet 9 inches tall and weighing 70 kilograms. We observed areas of ecchymosis on the epigastric area, measuring 20 by 17 centimeters, and on both right and left thighs, measuring 20 by 10 and 15 by 12 centimeters, respectively. There were also scattered ecchymosis on the lower back at the level of L1 until the level of the iliac crest at L4. Swelling was also noted on both thighs due to hemorrhage and edema. For the organs, the liver showed signs of liver damage. Microscopic sections showed hepatic necrosis, inflammation, and destruction of liver parenchyma. The kidney showed marked pallor on the cortex with contrasting areas of surviving medullary tissue. Intramuscular hemorrhages and edema were observed on both femoral muscles, abdominal muscles, and lower back muscles.
Are these findings congruent with someone who is a victim of hazing?
Yes, it is possible. The bruising and the ecchymosis on the patient's body all point to blunt force trauma caused by a heavy object. In the case of hazing, it could be a wooden paddle.
Thank you for your expertise, Dr. Exconde. I have no further questions. I will now call Dr. Foronda, who also examined the body. Your Honor, may I offer the victim's post-mortem lab results into evidence?
Go ahead.
Dr. Foronda, will you please state your full name and narrate to us the lab results of Mr. Mario?
I am Dr. Luis Miguel Foronda. Okay, so as you can see on the screen, the creatinine, the BUN, AST, and ALT levels are all elevated, while the BUN to creatinine ratio is normal. It is important to note that his creatine kinase was also elevated. He was also hyperkalemic, which could have caused fibrillation. And these elevated liver function tests are commonly seen in cases of severe rhabdomyolysis. The urine was tea-colored, cola-colored with acidic pH, and myoglobin casts, renal, tubular epithelial cells, and myoglobin were also present.
How do these findings correlate to Mario's death?
Well, to answer that, I would like to explain first the pathophysiology of the patient's injuries. You see, blunt force trauma causes muscle injury and rupture of superficial blood vessels, which manifested as ecchymosis on the patient's skin. This is followed by an inflammatory reaction to the site of injury, which leads to the muscle swelling in the victim's extremities with intramuscular hemorrhages, as well as hypovolemia. All of these will develop into acute kidney injury. Muscle injury and acute kidney injury contribute to electrolyte abnormalities, which lead to the fatal arrhythmia and subsequent sudden cardiac death of the patient. And based on these findings, we can conclude that his death was not likely caused by an underlying childhood condition.
Your Honor, may I offer Exhibit A into evidence?
Go ahead.
This is a CCTV footage taken on March 31 at 10 a.m. from the street of the frat house where the supposed hazing happened. And as you can see, two frat members identified to be Mr. Alessandro Rodriguez and Mr. Joaquin Ramos are seen disposing of a paddle-like object in the garbage can along the Pitan Street. Dr. Foronda, do you think that the paddle shown here fits the dimensions of the blunt object used to sustain the injuries?
Yes, it is very likely.
No further questions, Your Honor.
The defense may now call on the accused.
Calling Mr. Rodriguez, please state your full name.
Alessandro Rodriguez.
Where were you on the night of March 30 and the early morning of March 31?
I was sporting in BGC the night of March 30. The next morning, I went to the frat house to do some duties.
Do you have any proof of your whereabouts?
I was too drunk to take pictures, but I think my friends can attest.
Calling now Mr. Ramos, please state your full name.
I am Joaquin Ramos.
Where were you on the night of March 30 and the early morning of March 31?
I was in Alabang attending a friend's birthday party. I was part of the cleaning duties the next morning with Alessandro, so we cleaned the frat house together.
Do you have any proof of this?
I think my friends took photos of the party, but I'm not sure. I can neither confirm nor deny.
As you can see, Your Honor, my clients were not present at the time of the supposed hazing. They may be members of the frat, but there is insufficient evidence that they are involved in the incident.
The prosecution may now cross-examine the accused.
Your Honor, may I offer Exhibit B into evidence?
Go ahead.
Mr. Ramos, can you identify who the people in the photos are? The photos I am showing, Your Honor, are from a CCTV footage taken from the street of the frat house on the 30th of March at around 8 p.m., showing two men entering the said frat house. So, Mr. Ramos, please answer my question.
No, that's not us. The photo is too blurry for us to identify.
I have a closer view. Is it clearer now?
Objection, Your Honor. This evidence was not submitted beforehand.
Overruled. It was submitted yesterday. We will take a 2-minute recess. After that, we will ask both sides to present their closing arguments. The prosecution may now present their closing argument.
Your Honor, the death of Mr. Mario Cruz is an unfortunate one, but we can bring justice to his death in this court. The numerous evidence presented supports our claim that both Mr. Rodriguez and Mr. Ramos have violated the Anti-Hazing Act of 1995, also known as the Republic Act number 8049. Fraternity is supposed to be about brotherhood, but what happened during the night of March 30 was anything but that. Let us show that despite our broken society, justice still exists in this courtroom.
Defense, your closing argument.
Your Honor, the CCTV footage may have shown that these two men were indeed at the frat house at the time of the incident, but their involvement in the act of hazing has not been properly established. Please think thoroughly and with a clear conscience if you are willing to send these two promising college boys to prison, thereby impeding their potential as vital contributors to our society. I implore you to do the right thing.
Ladies and gentlemen, I have heard all of the testimonies concerning this case and have come up with a verdict. Wherefore, all of the foregoing considered, Joaquin Ramos and Alessandro Rodriguez, finding them guilty beyond reasonable doubt of the offense charged, are hereby sentenced to suffer the penalty of reclusion perpetua and a fine of 3 million pesos. Thank you for your time, ladies and gentlemen. Court is adjourned.